Our health matters. It shapes how we live, love, work, and plan our futures. Every day, we learn more about how human health is deeply connected to the health of our planet and to the actions of others around us. We are vulnerable, interdependent, and bound together across generations. In this conversation series, we speak with experts from around the world about these connections. This is an initiative of the Global Health Justice postdoctoral programme at Goethe University, Frankfurt. Welcome to Our Planet, Our Health.
Hello everyone and welcome to Our Planet, Our Health. In this conversation we explore how our health is connected to the planet's health and to the actions of people and governments around the world. Even in deep disagreement, we remain vulnerable and dependent on other humans, other living beings, and the system that sustain us. Today's episode is about climate change and health. I'm really pleased to be joined by Yasna Palmeiro-Silva. Thanks for being here. Yasna is a global health researcher whose work sits at the intersection of climate change, planetary health, and population well-being. She holds a PhD in global health from the University College London and is currently a postdoctoral scholar at the Center for Health and the Global Environment at the University of Washington. Trained as a nurse, she brings strong clinical and public health perspective to her research and contributes to major global initiatives such as the Lancet Countdown on Health and Climate Change. And thanks again for being here, participating, and for accepting our invitation.
Well, thank you, Romina, for this opportunity. For me, it's a real pleasure to be here and to have this conversation about something that I'm deeply passionate about. I mean, we really need to talk about this, about the connections between all climate change, human health, and all the health of the planet, right? So I'm really looking forward to exploring all these issues today with you.
Well, the first question is a more general question, and is how do you think that health evidence on climate risks and impacts can be incorporated in concrete policies, strategies, plans, and also in ethical guidance or ethical codes about how to address our daily life?
Mm-hmm. Well, that's the $1 million question, to be honest, globally, actually. And maybe it's right now, given the socio-political context that we're living in, is maybe one of the most pressing challenges right now. So from the science, from the evidence part, we already know we have robust evidence showing that extreme heat and climate change increases mortality, hospitalizations, and puts also enormous strain on health systems. But unfortunately, the speed where we see that translation from evidence to policy is actually not that fast as we really need to act right now. And maybe when we analyze that gap, we can find several reasons and maybe several intersectoral reasons, but also multi-level reasons. So first of all, we really see a disconnect between researchers, academic scientists, and policymakers. We often see that the policy and that the science and evidence world is pretty much different to the policy-making world. Because we speak different languages, we have different logics, we operate in different timelines, for example. So they are really different. Sometimes policies take years, 5, 10 years even, to make it happen. But actually climate impacts and climate change is happening now at a very fast rate. So we have that problem, and that is one of maybe the reason that our worlds are actually different. And maybe to address that, we need to really understand each world. One world is not better than the other one, but maybe they're just different, and we really need to understand to approach to each other in the very best way. So we need to maybe think about presenting data to telling stories about what the data means for real people, for communities, for example. What's the real impact in their constituents, for example, because they actually, policymakers understand and respond to narratives about their constituents and not just statistics. A second point is that we really need to integrate and include equity and equity lens in every stage that we actually analyze or discuss about. Sometimes policies require this asking who bears the greatest burden in terms of climate change impacts. And often it's outdoor workers, it's all the people without all the means for facing and dealing with this climate and this different climate. And for example, people living in urban areas where the urban heat islands occurs, etc., etc. So when we design some policies without the community's input, for example, we're putting more risk on their shoulders because we are leaving behind a lot of people without the capacity to deal with this. So we really need to understand that policies overall need to respond to communities and people's and societies' needs first. When we just lose that side, then of course the risks of climate change impacts increases. And maybe the third area to analyze, the third reason to analyze as a reason, but also as a solution, is timing. From the evidence bit, we have data, we have a lot and tons of information, but actually timing is crucial, and that data is not perfect. And we understand the science is not perfect. So we need to really deal with that imperfection. So to face that, we maybe need to think about how we can approach to this problem, which is actually damaging people. We have data, not perfect data, but we already know and have enough data to say that climate change is actually affecting people and people's health. So what if we take precautionary approaches, for example? What if we understand how early warning systems and cooling sensors work and how all those activities can improve and protect people's health? And how these interventions can be implemented based on what we already know, which is, again, not perfect, but enough in order to continue and refine our evidence. So we really are facing different kind of challenges because we speak different languages, but we have enough evidence and we have enough data. And also we know that we can take some precautionary principles to act now.
Well, this is clear, and I think that I can see now which are the limitations. But this is great because taking into account this, we can plan better the solutions. And next, I would like to focus on the second point about public engagement and stakeholder participation in the development of climate health policy. And one thing that we did with my team was analyzing the national adaptation plans from South America. And what we identified in doing this is that many stakeholders and vulnerable groups were part of the development of these plans. But even if you can identify in the first part of this plan that is a description of the situation, the inputs from the stakeholders, we couldn't find how their inputs influence the outcome and the actionable part of these plans. So we call this epistemic washing in the sense that, okay, the governments are calling these stakeholders for participating in this process, but they are not really, shaping the outcome of the process. And in addition, we saw that they were asked about the background conditions, right? Empirical information that they have access because of their positions. So they were treated like sources of information rather than agents producing and participating in the decision. and they were not involved in the normative and justice decisions that you mentioned. The decisions about who is going to bear these burdens and how we are going to allocate risk and which are going to be our priorities. So I wonder which is your impression about this, more globally speaking, because of your experience globally. And if you have in mind some way or some strategy we can push for correcting this kind of trend.
Mm, mm. So what you did and what you said is absolutely important and correct. So we often see that community participation as more kind of a consultation thing rather than a real engagement and where people are part of the diagnosis, solution, implementation, etc., etc. Communities are left just isolated and just are seen a kind of a passive entity, just receiving that law or that particular policy or program, etc. And I think that is something that really occurs because implementing a policy is very difficult, and we can understand that area and that bit, of course, but that doesn't imply that it's the correct way to do the things, particularly when we're facing this climate change and we really need to understand different perspectives. So I think that there's an ethical perspective here as well. And we, as researchers, for example, but also as decision makers or policy makers, we also have some of these kind of ethical or obligations with communities and how we do different things, right? Just doing a community consultation for just the sake of ticking the box is not real engagement. It's not even ethical. Maybe more than me in that regard. So I think that as researchers, for example, we must recognize that communities hold different knowledges and different levels of knowledge, and that we don't have access to really through different traditional methods. So people, for example, living in high-risk regions understand their vulnerabilities, their coping strategies, what interventions might actually work in their context, etc. So if we really ignore this also the different approaches, actually, what we are doing as researchers is producing science that has no effect or no impact in different communities, and also will not have the desired impact in different policies because we are kind of very far away from what we are understanding or try to understand and what's really needed. So I think that that's one problem. But at the same time, the solution would be in relation to that recognition, that awareness that we really need to have and increase sometimes. And also, I think when I see this in some communities, and as you said, the community is just over there. We go as researchers or policymakers, whatever, we do this kind of community participation, and then just we go. And communities are left to their own, capacity to deal with this. There is no more connection or more support, for example. So sometimes we just see communities as this, again, passive entity. We extract all the data from them. We do our analysis, and that's super good because we published the paper. But again, what's the impact of everything that we've done? Maybe very little. And also maybe it can be sometimes difficult for the community to build trust. And I think that that's something that we really need to talk about, trust, and how we build trust with different communities and within and between different actors in the society. That increases all the benefits of research, community engagement, etc., etc. So I think that we really need to change that focus, but that change should be, again, multi-sectoral, multi-level, and also linked with accountability. And I think that, again, this is something that we really don't talk about much, but what's the level of accountability me as a researcher to work with communities when we really need to think about more inclusion, more engagement amidst this climate change right now.
Thanks for the clear answer. And yes, I completely agree with you. And I think that we need concrete ways to identify or to assess the way in which interventions in communities for developing these processes or for doing research impact those communities, and which are in concrete the benefits that they are receiving in terms of climate health when they are participants on these processes. I agree again with you. And the next question I have in mind is about health professional duties. If we incorporate this climate health intersection and perspective, how this should reshape the way we understand the duties these professionals hold or have?
Yeah. Do you mean health professionals?
Yeah. Like physicians, nurses.
Exactly. Well, that's a really good question, because right now the topic of education in terms of climate change and health for health professionals is very popular right now. So when we analyze the potential benefits or the reasons why health professionals should be trained in this area, I see different benefits, different reasons. And the good thing of these different reasons is that it gives you all the extension to do and to analyze the problem from different perspectives. So we are kind of optimizing the potential wins of this education. So I think from one reason or one area is that clinicians are in direct link or in direct, they provide direct attention to patients, people, communities who are actually affected by climate change, by extreme weather events, for example. So we in the field, we really know what people are living when an extreme event comes and affect their communities. We really know how this affects the mental health of that population, the physical health of that population, and all the cascading impacts of an extreme weather event, for example, that was exacerbated by climate change. So as health professionals, we are there. We really live and accompany all those people. So that's one thing. So that gives us a different perspective to analyze, for example, how we prepare for these kind of events, how we establish some early warning systems, for example, how we increase resilience in the community, how we identify vulnerable populations in a more detailed way, and how we can deploy different resources or even redeploy different sources according to the community's need. So I think that health professionals need to be aware about the problem, need to be aware of the consequences of climate change and how this new climate will shape the needs of the community in terms of health, mental health, physical health, child health, maternal health, etc., etc. So we are kind of the first witnesses in that way. And because we understand that we can have a role in, again, that preparation, or preparedness, emergency responses, etc., so we can reorganize all the resources. But from the political or policy side, I think that there is also a big role. When we understand the problem, when we understand the consequences, for example, we are in a better shape or in a better position to advocate for some changes and for the prioritization of resources and needs and actions, for example. If we, for example, know one country, well, I'm from Chile, so I really know that what happens in the north of Chile, because it's a very long country, is totally different from the south of Chile. So when we understand what's the impact of climate change in these different regions, I am in a better position to say, look, we really need to identify all the priorities for the north, for the north area, for the central area, and for the southern area as well. So that gives you the perspective of public health administration and public health planning. So at the managerial or even decision making in a more political way, health professionals can also support and provide some kind of key information to do that. But also, for example, when we are in another setting of, for example, and say when we are planning the healthcare resources in a hospital or in a health center, we're in a better position to say, look, if we have a forecast of a heavy rain event or a heat wave, for example, we are again, with all the awareness and with all the concepts and information, that says, okay, we really need to prepare for this and organize and reorganize our resources. So it gives you kind of very tangible tools for your work to respond to this event and then to protect population health. So if you ask me why this is important, well, I already told you, right? But we really need to be focused on that health professional education. But again, if we take a precautionary perspective, a preventative perspective, I would like to see more education in terms of health, climate change, sustainability, planetary health, etc., across every single profession that we have, every single area or of development, for example, even from school. So if we implement all these contents and all this education at the very beginning of our education, I think that the wins will be actually greater. So, but that's a personal opinion. But I think that we should move toward that one.
Yeah, I agree with you with your personal opinion, which is obviously, supported by all your work. But I wonder, because when we have the case of an extreme weather event that is clear for us as such, I think that we can expect, institutions and professionals to respond and to see the cases as part of this situation happening. But when this is not clear, perhaps because of our epistemic situation, or perhaps because of the lack of policies or mechanisms like a forecast, or we have this in place but it's not working, then when someone come to the emergency room because the consequences of the heat wave, perhaps it's difficult still for clinicians to see this as something connected with the climate and the heat wave. And the same for the patients in the way they reconstruct what is happening to them, right? And how, in that sense, I think that what you just said on that education at school level is also important, not only for professionals. I think that this can help to address this issue. But I wonder if you have more strategies in mind about how to deal with this problem.
Yeah. Well, that is a good question. And actually, I agree with you. I mean, when, for example, people are more aware of that this problem is a real problem that can affect their health, maybe the overall approach of society to this problem is going to be different, right? And that is linked to maybe how we plan our cities, how we plan, how we build, for example, houses, etc., etc. So if we start with education, but also with a little bit of advocacy and also a little bit of science and evidence-informed policies from this perspective, I think that we can advance and progress a little bit in terms of having more holistic public policies and also from public policies, to the actual individual decisions that we make every day. So I think that education is key. Education has transformed our lives throughout the whole years of our history. So I think that education is key, from kindergarten to schools, primary, secondary school, till university, tertiary education, etc., etc. So that's one thing. And also, it shouldn't be that education only kind of a theory-based education, but I think also practical-based education, which means how, for example, we include some practical activities during our education, which implies going to the community, work with the community, do some stuff in the community, etc. So people are actually living their they are experiencing what people in communities are actually living, and we don't just do some desktop work, etc., without that perspective. So I think that education theory, but also practical, is very important. The second bit is that, and I ask myself whether it's good or not to frame everything, every single extreme event, weather events, for example, as associated with climate change. Is it good? Is it bad? How will that impact population perception of climate change? How that will impact, for example, how people react and act when an extreme event comes that, again, we know that exacerbated by climate change, etc. So I really don't have that question. It's a question that I have in my mind and I ask myself. But I think that understanding and communicating and discussing that summers are not the same as 30 years ago, I think is super useful because, again, increases the awareness and increases and changes the level of risk that we understand that is associated with climate change. And people can also be first more prepared to deal and to face climate change or events that are associated with climate change. But also that helps in terms of the, again, political accountability. If policymakers respond to their constituents, then what if their constituents are actually aware that this is a problem and their community is not prepared for this new problem, and their politicians are not acting on this in a timely and adequate manner? So again, it's a kind of a circle, a positive feedback loop that says, if we discuss, if we have some, public discussions in terms of the problem, if we, for example, create a little bit more community in terms of climate change and health and how we respond to it, then it will increase and respond and maybe fit to that positive circle again. So education, public discussion, and maybe a third component here, and very important, is communication. And the role of mass media, for example, the role of journalists is something that we, as researchers, we don't work that much close, but we really need to work very closely, because communicators, journalists, they know how to communicate to different audiences to get and convey that main message, which is climate change is real, is associated with all these extreme weather events, and actually is affecting people's health. So how we communicate and how we frame it is a role, maybe, or is a responsibility that mostly lies with journalists and communicators. So I think that a third option and a third intervention might be is working together with journalists, communicators, to really convey and transmit that information.
Thanks. And I find your question about how to frame each event or each situation pretty interesting and original. And I think that this is the kind of exercise that we need, since things are not working as we expected for advancing in a solution. I think that we should make these kind of questions. And so I am looking forward to to seeing your responses to this question.
Oh gosh, I do hope
in the
I
future. Well, the last question I have for you is about reproductive rights, and I saw that you have some work on this. And my question is, which are the complications that climate change add to the already bad situation in terms of access to reproductive rights and sex rights for women and also for other communities like trans people, for example? Which are these connections, impacts? And I'm thinking in how many situations can be worse in the context of a climate weather event, but also in the context of climate displacement, right? We have the example of ongoing climate displacement, but also other kinds of displacement. So we already can check some data about what happens in those contexts with these reproductive rights or sex rights.
Yeah. Well, yeah. I mean, climate change is an exacerbating factor of many inequalities that we already are facing, etc. So if we have a very bad situation in terms of reproductive rights, women's health, for example, what's climate change doing is actually worsening all that and all that inequality and all that gap. So we can see that climate change effects and climate change impacts actually is having a lot of pressure, is putting a lot of pressure on women's health in multiple ways. So, for example, when we look at a heat wave, so a heat wave, we have heat stress, and physiologically speaking, pregnant women or pregnant persons are actually in a worse position compared to an unpregnant person or just a man, for example, because heat stress increases the risk of preterm birth, disrupts some healthcare access during extreme weather events. So putting again and increasing that gap and that inequality in terms of access to different reproductive services, etc. When we design, for example, adaptation policies, what we can do is to integrate and ensure that women are part of that decision-making process. Because sometimes policies are made in a closed room, with no women's perspective in it, and we know that, and the evidence says that creates and recreates all the inequalities, the long-standing and the historical inequalities that women has been facing right now. So, for example, disaster planning has been dominated by different perspectives that overlook reproductive needs, access to contraception, menstrual health supplies, safe delivery services, etc., etc. When we see and we analyze, for example, underserved communities, we know that policies must address existing barriers that climate change is exacerbating. Again, linking to that what I was saying before. What does it mean? Well, it means that we need to invest in resilient health infrastructure, which would all not just improve and improve the access to health services to different vulnerable populations, but also to particularly women. We need to train different community health workers in this area. What does it mean for women in particular with different needs? And also ensure that the supply chains for reproductive health commodities can actually withstand all the disruption. Because when we have isolated communities, for example, that were affected by an extreme weather event, we need and we know that supply chain can be affected, and that can affect all the needs that women have also in terms of reproductive health. And also in terms of what you said, the climate displacement. This is important, this is critical, but also very difficult to analyze. Right now, we are kind of understanding what climate migration, climate mobility, but also climate displacement is, and actually what they mean. And when we add that women's perspective or that gender perspective into this, we also need to look at some different frameworks. Displaced women in general face heightened risks. We know that we overall lost all health providers. There is a breakdown of social support networks. There is an increased vulnerability to exploitation, in particular in contexts where we see displacement, but also conflict, where, again, some events do not happen in isolation, but maybe happen at the same time. So we can actually have an area affected by an extreme weather event, but also conflict, etc., etc. So we are actually increasing all those risks. So policies need to guarantee that access to comprehensive reproductive services, etc. And one important thing when we think about policies and how to protect women's health and also by extension sometimes child health as well, is that policy do not reinforce inequalities and inequities. We know, for example, that family planning should never be framed as a climate solution that sometimes we hear, right? I mean, I'm not having children because of climate change, or it's better to stop population because of climate change, etc. That framing and that words actually put a lot of pressure on women's bodies, on women's shoulders. And we really need to understand that this is a more complex problem rather than just deciding whether I have a child or not, etc. So if we really need to include that gender perspective and protect women's health, for example, that we really need to understand that this is a very complex but holistic problem and solutions as well. And maybe the most important thing is how we think about policies, how we think about programs, including that women's perspective. Because in that way, it's not going to be 100% guaranteed, but we can include and decrease the impacts of climate change on women's health.
Here, I think that it could be really useful, the gender perspective of on which voices are relevant in this debate, in the sense that many events associated with reproductive rights, like pregnancy, are, as the philosopher Fiona Waller argued, epistemic transformative experiences. So the only way to have access to the knowledge about these experiences is by incorporating the voices directly from the persons who has this experience. Thanks a lot for your answers. As always, I'm super happy and learning a lot listening to you. And thanks for joining us. And
Romina, it was my absolute pleasure. So I'll be happy to continue to support this. I mean, if we really want to progress on this, we have to discuss, we have to talk, even more when the world is a little bit crazy right now. We really need to connect, talk, discuss, and share some experiences. And it's maybe that way to move forward. So thank you for the space. Thank you for the opportunity as well.
Thank you again, and thank you to our viewers for being part of this conversation, and join us next time on Our Planet, Our Health.